Hello, my name is Christina Mannion. I'm one of the immunisation nurses. I work for Vaccination UK and we work in partnership with the NHS and Public Health England. I and my team here at Vaccination UK, we deliver the school-aged immunisations to all the schools in Enfield and Barnet. And today I'm going to talk to you about the Year 9 vaccinations. So we'll be looking at what these Year 9 vaccinations are and what happens on the day of the vaccination. So, what is diphtheria, tetanus, and polio? So, diphtheria affects the upper respiratory tract, causing breathing difficulties. It also produces a toxin that damages the heart and the nervous system. What it does, it creates this really thick coat at the back of the throat, making it very difficult to swallow, and the neck kind of swells like a bull neck. And this is spread from person to person when an infected person either coughs or sneezes. With the tetanus, tetanus is a bacterial disease, and this affects the nervous system. And what it does, it causes really painful muscle spasms, making it hard to breathe and move. But tetanus is actually found in the environment. So this is found in soil, so like dirt, rusty tools. So it might be like old barbed wire or a rusty nail. And it's also found in animal feces as well. If you have actually been unfortunate to be bitten by a dog or an animal or some type of animal, when you present at A&E, the first thing they would do at A&E is give you a tetanus to protect you from the tetanus disease. Um, so that one people are more familiar with the tetanus. Polio. So polio that affects the nervous system. Okay, so it's a very contagious viral disease, and what it does, it causes total paralyzation of the muscles in a matter of hours. Okay, and this is transmitted through person to person, and it's spread mainly through feces, so from poo and contaminated water or food. Once it gets into your gut, so once it gets into your intestines, your stomach, it multiplies and multiplies. So if you could imagine, if it paralyzes muscles, if it paralyzes your muscles in your respiratory system, so where what helps you to breathe, you're not going to be able to breathe. Um, these diseases are all very, very serious, but what we can say is we're very thankful that we can say that a lot of these diseases are very rare in the UK, and that's because we have such a good vaccination program. However, they are still prevalent in other countries, and people do travel, and that's why it's very important that we stay up to date with our vaccinations, because people from different countries travel back to the UK, and that's when the diseases can spread. So I did mention that it's still the diseases are still in different countries. So polio has been eradicated, gone in most countries, but it still exists in parts of Pakistan and Afghanistan. And as I mentioned, people are traveling, so they could bring the diseases back into the UK. Diphtheria and tetanus. This is a global concern, meaning it's worldwide. And diphtheria has seen recent outbreaks in countries like Nigeria and Guinea as well. So we call this the 3-in-1 teenager booster vaccination. And we call it the 3-in-1 because it covers three infectious diseases, diphtheria, tetanus, and polio. And the reason we call it as a booster is because those up to date, if you're up to date as a baby, you would have already had the vaccination 4 times, and you need five in total to keep your immunity to protect through adulthood. So this will be your fifth dose in school. So as you can see, I've included this little book here, the red, it's our health record book. So many of you will recognize it. If you were born outside of the UK, you will have a different healthcare record book. But all of your baby immunisations are all recorded in your health record book, and the diphtheria, tetanus, and polio are part of your baby vaccinations. The only other time you would get so you would have had it 4 times as a baby, and this is your fifth dose in year 9. The only other time you would have had the diphtheria, tetanus, and polio vaccination is if you have went travelling to certain countries where you are required to have the vaccination done before travelling, or if you have had an injury and you've had to go to A&E, that would be the only other times you would have had this done as a teenager or in the last few years. So what is the meningococcal disease? Okay, so the meningococcal, so the meningitis, can cause meningitis and septicemia. So meningitis is a very dangerous swelling of the lining of the brain and also the spinal cord, and it has many health complications. What come with it. So you can cause brain damage, amputations, meaning you can use your arm or your legs, hearing loss, memory loss, learning difficulties. It's fatal. And septicemia is when bacteria enters the bloodstream, causing blood poisoning, which triggers then sepsis. Okay, so the meningitis ACWY, which we offer in year 9, it protects against 4 strains of meningitis, and them strains are the A, C, W, and Y. And the reason we offer this now at this stage is because they're the common strains what affect teenagers and younger adults. As a baby, part of the baby vaccinations, and referring back to that red book or your health record book, babies are offered a meningitis B, because B is the most common strain that affects babies. Okay, but as you get older, in teenager and younger adults, it's A, C, W, and Y. But what I want you to be aware of is that um, there's many strains of meningitis. So it's very important that you are aware of the signs and symptoms, because not all of you may have not have received the meningitis B vaccination as a baby, and some of you may not have had the meningitis A, C, W, and Y in year 9. So it's very important that you are aware of the signs and symptoms of meningitis. So even if you have received the meningitis A, C, W, and Y, um, it's important that you're aware of these. So, some of the meningitis symptoms could be a severe headache, sensitivity of light. So, what I mean by that is if you feel like you can't have the light on, you want to be in a dark room, you want to wear sunglasses, you might have very cold hands or feet. And another sure sign is maybe you've got a blanching rash. So, if you have a rash and you put a glass on it and you roll it over and that rash doesn't go white, that means it's non-blanching. Okay, and they're very serious signs of meningitis and needs serious emergency urgent medical attention. So some of you may be familiar with the pilgrims, because millions of people all over the world travel here every year to Mecca and Saudi Arabia. And what happens is, because so many people travel here, it becomes very overcrowded, which then increases the risk of transmission of diseases. And meningococcal, so meningitis, has had several outbreaks here at the pilgrims. So in response to this, the Saudi Arabia government have now required that anybody traveling to the pilgrims will have the meningitis ACW and Y, and this will then prevent further outbreaks. So this is something now that it has to be done. So when I spoke about travel vaccinations, this is something, if you're traveling here, everybody traveling will need to have the meningitis ACW and Y vaccination. So why have the vaccinations? So vaccinations are like practice for your body's defense. So if you were going for a football match or any kind of sport, you would do lots of training beforehand to make sure that you were able for that. And it's the same with a vaccine. So the vaccine helps your body make antibodies. So when you come in contact with a disease, your body's then able to recognize that and fight it away and protect you. That's what vaccinations do. They help you build up the antibodies so you're able to recognize a disease, a virus, and fight against it to protect you. And as I said, these diseases are now rare in the UK because of our robust vaccination program. If people were not to have the vaccinations, these diseases then start coming back, which we've seen over in this year and last year with other diseases. When people have not had the vaccinations, the diseases start coming back in and we're having outbreaks. So it's very important that everybody does stay up to date with their vaccinations. So who can have the vaccination? So teenagers aged between 13 and 15 are routinely offered the meningitis ACW and Y and the 3-in-1 teenager booster. So that's a diphtheria, tetanus, and polio. The only other time you will have received these vaccinations outside of school is if you were traveling to those certain countries where you need to make sure that you're protected before traveling. Um, Some of these countries would be, as it's Saudi Arabia, Asia, Afghanistan, Pakistan. There's a number of countries where you do need to have vaccinations before traveling. So I've added this slide in because I got this slide from the UCAS website, and UCAS is what is used for students to do their application to go to university. And as you can see on the UCAS app, on their website, it actually says to make sure that you, before buying your duvets and before buying all your cutlery, that vaccines are all up to date on your to-do list. And the reasons for this is because universities can be an absolute hotspot for outbreaks for measles, mumps, rubella, HPV, and especially meningitis. Okay, meningitis spreads very, very quickly amongst young people. You've got to think when you're at university or college, you're all spending lots of time together, you're meeting, you're now living with lots of new people from all over the world. So it's really important that you do stay protected, and the vaccines are something which will protect you. So, just some tips for the day of the vaccinations. So, do not worry. Okay, the nurses are absolutely lovely. If you are someone that gets nervous, try, because when I speak to students, they usually say the worst thing is waiting around and thinking about it. So, if you are someone who's nervous, just let your teacher know. Come and let one of the nurses know and get it over and done with. And 9 times out of 10, the majority of people who are nervous go, "Oh my gosh, is that it?" They can't actually believe it's been done so quickly and it's not painful. Okay, so what I would say is have your breakfast if you can on the morning of the vaccination. Breakfast is the most important meal of the day. Um, if you can, wear a short sleeve shirt. If you don't and you forget, it's absolutely fine because we'll just undo a couple of buttons on your shirt and we'll bring your shirt down because your deltoid muscle, where we give the vaccination, is it's in your upper arm. So if you've got a long sleeve shirt and it doesn't always go up, it's very restricted. So we just undo a couple of buttons and we pull your shirt down that way. There will be screens for privacy as well if they're needed. Um, the nurses are going to ask you some very simple questions just to help identify that we've got the right child sitting in front of us. Um, and you're going to go straight back to class after you've had your vaccination. There's no need to hang around. And as I said, if you are someone who's nervous, just make sure you come and let the teacher know, just the nurse know who's going to be with you. And you've got to remember that when you were little, so when you had all these vaccinations done as a baby, the needle what is used on to giving them vaccinations as a baby is the exact same size needle which is used now. It's very small. Okay, it's a very tiny needle which we use the same size on little like 8-week-old babies. So you can imagine it's very small. So it's usually when we do the year 9 vaccinations, it's 2 vaccinations. So one will be in the left and one will be in the right. But some of you may have already had somebody's vaccinations, so you may only have one vaccination, okay, on that day. If you are somebody what needs it in one arm, both vaccinations in one arm, that's absolutely fine. And just remember, nobody really likes injections, but it is very, very quick, okay? And it may come with some very, very minor side effects, which might just be a little bit of an achy arm, or it might just be a little bit of red or swollen around the site of injection. What you've got to do is just weigh up in comparison. If you were to get one of these diseases, to contract one of these diseases, what you'd have to go through then to have a little injection to protect you, you've really got to weigh it up because if you were to get a bit of a sore arm from it, or a little bit of a fever, because what happened, you might feel a little bit more tired because what happens is when your body's building up the antibodies, it's just having to work that little bit harder. So it might make you feel a little bit more tired that evening. But you've got to remember that these little minor side effects are not going to last more than 1 or 2 days. Okay. And we're not going to give you this vaccination without your consent. So we cannot give an injection without receiving a consent form back. So what happens is my team at Vaccination UK, we send out all of the comms to the school, and the school then send it out to your parents and your carers at home. And what they're sent is information about the vaccinations, and they're sent an e-consent. This e-consent needs to be filled out for everybody, whether it be a yes or a no. Because what happens is because all of these diseases are reportable diseases, they'd have to be reported to NHS England. And what then would have to be done is there'd have to be a huge investigation as to how somebody contracted these diseases. If we have something which is preventing them, we've got a vaccination which prevents these diseases. So, how has somebody contracted it? So, if we've not got a consent form filled out, we then need to call every single person's parents or carers to make sure that they've been given the opportunity to protect their children. So it's really important. So in your class now, you will be given, because I've given it to the teacher, a QR code. That QR code is to be brought home. If you know your parents or your carers have not filled the form out, please bring this QR code home and fill the form out. If you have filled a form out already, you do not need to do it again because we only need one consent form back for each person. Okay. If you are under the age of 16, you can give or refuse consent if considered competent to do so by the nurse and staff. Okay. And if you do need more information on this, please just speak to the school nurse, the medical officer, or give us a call. I will be giving you our details in my end slide. So there's lots of people what can help you out with this consent. Okay. Oh, and I wanted to add this slide in because usually when we do the year 9 vaccinations, it can be during Ramadan. So many people are celebrating Ramadan and unaware that when that receiving vaccination, it does not break your fast, okay? Because there's many Islamic scholars and organizations, including the British Islamic Medical Association and also the Council of Britain, they all confirm that receiving a vaccine via injection does not break your fast. And this is because it's not nutritional. It's not reaching a throat, it's not going in your stomach or intestines. But if you are still uncomfortable with doing this within Ramadan, we will we will be offering clinics outside of school at a later date. But what you need to remember is you still need to complete the consent form, and then on the day of the vaccinations, when you come down, and if you don't want to have this done on that day, you let the nurse know your reason why, and then we would then have to book you in at a later date. So I've just added this one in here because just a few myth busters. So the vaccination does not contain gelatin. Lots of people do ask that question. So it is gelatin free. And also the vaccines cannot give you the disease. Okay. The vaccines uses inactivated components. So the ingredients that go into it, they're inactive. They can only help protect you building immunity. So they can only help protect you from the diseases. They do not give you the diseases. And even healthy people, even if you're someone what never gets sick, okay, you can still get these diseases. And vaccination will be the only protection which can protect you. And you've got to remember that you're not just protecting yourself, you're also protecting babies, pregnancies, people pregnant around you, and those with weaker immune systems as well. And just because you've had them as a baby, it doesn't mean you don't need them again. As I've already said, it's your booster. We need to boost the diphtheria, tetanus, and polio to produce and sustain that immunity to the diseases. It's very important. So if you do need any more information, please, you can go on the School Vaccination UK. We've got lots of information there. The NHS have lots of information. And please feel free to call us or email us. Our number's on there, 0208 150 7505. If you were to call us, if your parents or carers or you have any questions, that is what we're here to do. We're here to support you to make sure that you've given informed consent to the vaccination. And just remember that vaccination saves lives. So after clean water, vaccination is the most effective public health intervention in the world. Thank you so much, everybody. I hope you've have found this valuable, and please just remember we're here to answer any questions if you need to, if you need anything answered.